Alright, so we now have 6 deaths in the US from the coronavirus. We now have 100 cases in the US because of the coronavirus. It basically went from 1 death just a few days ago to 6 now. All within this small community in Washington State. And according to NBC, that community may have been compromised for up to 6 weeks without really knowing about it. So the thing is, there could be hundreds of more cases of either people asymptomatic or just people not knowing that they're ill. And this is a nursing home type community, and just 6 deaths that quickly, right at 100 confirmed cases in the U.S. And now there's a confirmed case in Rhode Island. Now there's a confirmed case in Florida. So the thing about Florida, you're dealing with a lot of older people there as well, with like nursing home communities, retirees. A lot of people retired to Florida, and Washington State and Florida and San Fran all have state of emergencies. It's a new case in New York. That's likely going to spread very quickly in New York, which is kind of sketchy. So we might see a state of emergency there as well. So globally, outside of China, there's 9,171 confirmed cases. Again, there could be several thousands more. That's since this morning. There's now so this morning there was 9,171. Now there's over 10,000 in the world. This morning there was 136 deaths. That's obviously climbed since this morning. So we're seeing an increase in the confirmed cases from this morning to yesterday morning of 28.09%. And an increase in the death toll outside of China from 20, and this is outside of China in the last 24 hours from this morning to yesterday morning about 7 a.m. when it updates. This is a John Hopkins update. So we have the death toll that increased 23.64%. So again, we now have over 10,000 cases outside of China, confirmed cases. 100 cases in the U.S. confirmed, 6 deaths, all within Washington State. I used to live in that area, in SeaTac. It's in King County, I believe, all the cases, or in that area. So we have 10 countries with at least 100 confirmed cases each. Several of those 10 have thousands of cases of confirmed cases, and there's obviously going to be plenty more in that list, and each of those 2 lists with cases that we don't quite know about, either asymptomatic or more mild cases. As I said yesterday, 18 to 20% of cases are severe or critical condition, with globally there's 3.4%, just over 3.4% mortality rate of that 18 to 20%. In the U.S., we're looking at 6%. So that's, as this expands, we see this in Italy, as this expands, these resources are going to be more and more limited, which means that it's going to drain our healthcare systems, our medication, hygiene, that sort of thing, personnel, healthcare personnel, and that could lead to a higher death toll. With these 6 deaths in the U.S. that just recently happened, 5 just basically in the last few hours, last 24 hours definitely. The stock market has actually increased. Dow Jones went up 5%. So I talked about this yesterday. It went down 9.74% from when it opened last week on Monday to when it closed last week on Friday. Well, now since opening today, since it's Monday, it has actually went up 5%. As I said before, right now is a time to buy in the stock market, because this is expected to peak next month in April. It's early March, so we could have anywhere from 4.5 to like 8.5 weeks until this starts to die down. But I think it's going to be short-lived in terms of the stock market too. I think if you haven't invested, then it sucks to be you. So like I said, state of emergency in Florida, Washington, San Fran, and I would expect one in New York. There might be one in New York by the time I post this. Alright, so the deaths in Washington, the first death was someone in their 50s, and I believe these 5 are the deaths, at least from what I've read, they're elder people. Generally, I wouldn't say 50s is really elderly, but I know at least the first two. So the one that happened earlier was in the 50s, and then there was someone in the 70s that died. But I know both of those two had health issues, underlying health issues. So this is I made the video yesterday comparing this to the flu. There's people who are reacting to this as if, oh, this is nothing. It's just we need to worry about the flu more. Well, obviously the globally, I use a lot of numbers outside of China because I don't think those numbers are realistic. I think they're artificial to help our economy and to help the stigma, to push that away from, hey, this is a Chinese disease, etc. But globally, the mortality rate is just over 3.4%, making the mortality rate of the coronavirus compared to the flu globally. So in the context of the seasonal flu in the U.S., the mortality rate of the coronavirus is over 60 times higher. To restrict that more towards a Western nation that actually has quite a few cases, Italy, where it's actually over 45 times higher. The coronavirus, the mortality rate is actually 45 times higher than the seasonal flu for this specific flu season, which starts around October. That's just something to think about. Medication, hygiene, fluids, calories, and like batteries and heaters and stuff like that, like kerosene heaters. So those are things to get. Obviously, with these states of emergencies, there's going to be a rush towards supermarkets in the U.S. I know there's already been like Black Friday type events in Italy. Actually, worse. I would expect much worse in the U.S. because people are nuts. But just something to look at. And I would buy this early. I've warned about this plenty of times before, but definitely get the medication. Worst case scenario, expect to have it and expect the stores to run out. So definitely need that medication. And I mean, I would want at least 800 calories and at least, let's say, 24 ounces of water a day to sustain yourself for at least several weeks. You could sustain yourself easily off of that amount of, unless you have underlying health issues, then that's something else. So at least get some medication, and I would get, maybe if you can, get a little bit of extra food and water here and there at the very least, and hygiene, obviously. Some kind of Clorox wipes, maybe some Germex, some isopropyl, 70 or 90%, etc. And that sort of thing, some extra batteries. Just something to think about. All right. See you tomorrow.